All right, everybody, welcome back. Thanks for joining us. Whether it's your first time tuning in or you're just visiting us for the first time, we're glad that you're here. Let's go ahead and get started. With me as always, by the way, my name's Phil. Had a little forgetful moment there. Forgot who I was, but let's not forget this guy, Dr. Todd.
Thanks, Phil. Great introduction. And, fitting, I think, because of the topic of discussion today. And by the way, completely not rehearsed. I promise you that the topic today, just kind of going back to our first episode, we talked a lot about primary care, preventative medicine. I hope you guys tuned in for that, and I hope you learned something from that. That's a topic very near and dear to my heart. Today, we're going to talk about a topic that I think is more near and dear to your heart.
Mm-hmm.
Going to talk about ADHD.
ADHD. The common thoughts, misconceptions, beliefs, just general understanding of what it is, how it works, and what we do with it.
Yeah, absolutely. Something I see every day in clinical practice, something I'm seeing more and more, actually. And part of today's discussion, I think, will be going into why that might be. Mm-hmm. But I am curious about your own experience. So tell me about what ADHD means to you.
Well, firstly, I don't know if you folks have seen this before, but that's cool. Sorry, got distracted there for a second. Just kidding. For me, it was something that I dealt with a little bit more in my youthful years. Not to say that I don't deal with it now, but the way that it affected me. When I first heard about it, they almost had two categories of the ADD and the ADHD. The kid that can't pay attention, but at least he can sit still. And then there's kids like me.
Sure.
And I thought that was actually just something that was part of childhood, adolescence. I thought things would change as I grew up. And to an extent, maybe not necessarily that they've changed, but perhaps I've learned how and adapted on how I can function in life with this. But yeah, that's definitely been something that proved to be a challenge through school years and even through my professional careers.
Yeah, absolutely. I think you hit on a couple of things there that commonly come up when we talk about ADHD, one of which being that is ADHD a childhood diagnosis exclusively, right? Does it affect adults? Well, spoiler, absolutely it does. And that kind of goes back into the way, the DSM-5, the diagnostic criteria for, say, mental behavioral health disorders, back in 2013. This is actually a common misconception. So some people out there think that ADHD actually was not recognized in adults until 2013 when they updated the DSM-5. That's actually not technically true. Although admittedly the language surrounding it became a whole lot more, we'll say, broad, and it started to maybe more characterize ADHD in adults. And by the way, I keep saying ADHD. I know, and you touched on this, ADD versus ADHD. Mm-hmm. Is there actually a difference? And the reason I keep saying ADHD is, I guess it's because it's been more beaten into me through my medical training. The term ADD has sort of gone away.
Right. I don't hear it as much these days.
Right.
But the difference between attention deficit disorder versus attention deficit hyperactive.
Yeah, and exactly. And now what we would say, so if somebody will say had more of an attention deficit disorder without the hyperactivity component, then we would call that ADHD, but inattentive type. Whereas somebody could have a mixed ADHD type where they actually have both inattentive and hyperactivity. And then now we're actually starting to characterize more of the impulsivity, mm-hmm. ADHD with impulse control, problems. And, and you also touched on another important thing, and what is age appropriate, right? What is considered age appropriate? Children oftentimes are going to be very hyperactive, very short attention spans, and that is absolutely appropriate for, say, age. But there are those who maybe go beyond the bounds of what is maybe considered normal and appropriate. It also looks different in girls as well, typically. And this is something that I'd like to maybe increase some awareness in our listeners. Is it can feel different and oftentimes would go misdiagnosed or underdiagnosed in women or girls because they were maybe less likely to have some of the hyperactivity component. And so, that, because obviously, at the end of the day, our observations are what guide us and things.
Sure.
And so if we don't observe somebody that's, bouncing off the walls, running into things, falling down, the proverbial squirrel, which is sort of the
Squirrel.
stereotype.
Yeah.
Exactly, that's the stereotype, right? It's a stereotype to a large degree because we see it, but we don't quite see it as often in girls. And so, I think through the course of this discussion, I'm hoping maybe this piques some interest. If you're out there suffering from ADHD, maybe this will just give you a little bit of insight into your own diagnosis, or perhaps some things maybe you already knew, maybe you don't. Or maybe you're out there and you don't know whether or not you may have this, and we can maybe help guide you to a not necessarily a diagnosis, but maybe provide some helpful tips and tricks and strategies to help combat it.
I love it, and I can't wait to jump into this. One of the things that I found interesting about learning more and more about ADHD is the impulsiveness that I didn't realize that throughout my life, that is something that I've dealt with, the impulse control linked to ADHD.
Yeah.
And I mean, just as an example, in adolescence, when it was really becoming a lot more, noticeable in my behaviors, there would be something as simple like, I remember my poor third grade teacher had to deal with this child that just boundless energy bouncing around. I literally, mid-lesson, she's talking, and I'm not doing this out of maliciousness. I would get up and just casually walk up a few seats because I had something I wanted to share to my buddy here. I just wanted to tell him, dude, you got to know this. And I had to share it right then and there. And it's this urge, this impulse that kind of guides you into your decision-making process. And I would behave in certain ways that, like, nowadays, I'd be like telling myself, like, kid, what are you doing? And it's
the
nature of things.
It absolutely is. And I think maybe the way I would describe that is it'd be like having the engine of a Ferrari with the brakes of a bicycle, right? You have this powerful motor, this ability to go very fast, very quick in one direction, in the inability to slow yourself down. And that's really where that impulse control comes. Those brakes start wobbling, and frankly, it's you either complete the mission, so to speak, or you're going to crash and it's going to burn up. And that's really be part of the problem, because I think one of the things we wanted to talk about today was sort of the emotional regulatory issues that come with ADHD, and some of the reasons why, and then maybe also get into a little bit of how this can sometimes affect relationships. Because if you don't have ADHD and you don't really have the context of which to view it, it can seem like, let's say your partner has ADHD. It can seem like maybe they're disinterested at times, or maybe they're not as observant as you want them to be at times, and that can obviously sometimes cause a strain. But it is absolutely not intentional. And now that's not to say that maybe there isn't some need for discussion on how, if we ourselves have ADHD, how we can't help be more present, or we can't help maybe strategize on how to combat some of our own impulsive nature. But,
Exactly.
So I think there's a lot to be learned really around the entire pendulum of how this works with people.
I agree. And I'll tell you what, it's like an onion, because you just peel back and there's layer after layer after layer, and there's so many different things to dive into. It's going to be impressive to try and fit in what we can for this discussion for this one episode, because there's just so much that we could talk about.
Yeah, fair enough. And I think, if this is something that ends up, to the viewers, right? If this ends up striking your interest, let us know, and we'd be happy to jump into a part 2, part 3.
Absolutely.
Because I do think you're right. I mean, spending 20 minutes here talking about HD is frankly not enough time. But at least we want to get our, get the feet wet, dip in a little bit.
Mm-hmm. I think it's definitely something worth talking about. And if you have comments or questions about things, or you want to share some of your own experiences of whether it's something you've dealt with personally in your life, having ADHD, or like you were mentioning, something with a partner or a friend, or even a coworker that just sometimes might get on your nerves a little bit.
For sure. Now, provide a little explanation why. So, yeah, right. I guess to dive into it, what is ADHD? What does that mean? How does it affect the individual? Right? What's the chemistry behind it? I suppose maybe that's the best way to phrase it. And really, I think it may be the most simplest terms. It really is a problem with sort of the misfiring, or maybe not misfiring, but underutilization or underfiring of that prefrontal cortex in the brain. This is the area that it targets motivation, it targets focus and attention, that impulse component. And it's important to note, though, and I think this is very important. We're not saying that this is why I want to be very careful about those words and say that this is not an underdevelopment issue. This is not these are not folks who have limited intellectual ability. Far from it.
Right.
Actually, a lot of times, I would venture to say some of the most intelligent, successful people in the world are probably have ADHD. But all of those people, though, struggle with the way that neurotransmitters are, say, formed and produced in that prefrontal cortex. And the two most common ones, or at least the two big ones, are going to be norepinephrine and dopamine. So dopamine being that motivational hormone or neurotransmitter. This is what really gets us going. And then, of course, norepinephrine being the focus and attention and planning, neurotransmitter. And so, as you can imagine, then when these aren't maybe produced in high enough quantities, or maybe not produced at the same level as, the quote neurotypical individual that lives next door to you, it's going to produce some of these problems that we see, or that we're talking about here today.
I like the fact that we're kind of breaking down the chemistry and how things work, because I think a big common misconception is laziness. And I know that's not the fact. Because if it's something that hits that dopamine center just right, it's almost adverse of what you'd expect ADHD to perform like. It gives you the ability to do hyper focus and really narrow in, tune everything else out. I mean, I can see that when my son plays video games. I mean, there's nothing else, and any questions I had about his focusing ability, out the window, because I know he picks up every detail of what he's doing right then and there.
You're right, and I think there's kind of two analogies I would use, and they'll be somewhat contrasting, which I think points to a little bit of why it can be somewhat complex. So the first one would be, ADHD is sort of like having the radio on and every single frequency is coming in at the same time, and your inability to sort of turn through and kind of isolate the one, that can become very distracting, right? It can become suffocating. And so having these sort of sensory issues are a very common thing with ADHD. But on the contrast to that, you hit on the hyperfocus ability. The analogy here could be like having 30 tabs open on your internet browser, right? But only one is you're zoning in on at the moment, and the rest couldn't care less about.
Right.
And that's partly why sometimes, though, you can see relationships strain, because as the individual might get into that hyper focus pattern, they may time blindness. So that's a common thing we'll see with ADHD, losing track of time, sense of time, being always quote late, because they are focused in so strongly on this one important detail. And there's another really interesting thing that I tend to observe with folks who get into this hyper focus tendency, and that is the sort of what I write. This is my own term, by the way. I've made this up, so I don't know if this is a real thing, but I have observed this, and let me know if anybody out there has experienced this. But I sort of will call it the I don't know how to word this well. The hangover effect. Maybe that's the best way I'll phrase it.
Okay.
So it's I've completed my task. I have focused so intently and so thoroughly, and now that is done, I now go into this sort of hibernation state of just pretty much can't do anything at that point.
Right, you're wiped out at that point.
Exactly, completely wiped, and there's a recovery that comes with that. And I don't know if you've ever experienced that. I mean, I certainly have observed that in my practice.
Right. I mean, I think I definitely agree to where you focus so much on a particular job that, firstly, like you said, with the analogy of the several other tabs being open, you focus so much on that one job that once that's done, you're just wiped. You've put everything into that. That hyper focus comes with a heavy energy drain, and And then all of a sudden, after that job is done, and you sit there for a second and say, now what? And you see all these other jobs or these tests that need to be done. And you're like, and it just, I need a recovery phase. I can't just jump right into these. And it's, again, I steer back to the fact that it's not a laziness. It's like you've put so much energy. It's like you just sprinted the 30-yard dash, but then it's like, okay, well, I still have to do this, cross-country trek that I have to run for. It's like,
Right.
not right now.
Not today. Yeah, and I think that goes back to the neurochemistry, right? So we mean you have, when you're in that hyper focus, you actually are producing adequate dopamine, norepinephrine levels, but your ability to sustain that is not going to be maybe as adequate. Again, it's kind of using the example of the next door neighbor who's more neurotypical, and so that, to me, I think that's how I would explain that from, say, a biochemical perspective, would be that you have expended all of your reserves of those neurotransmitters and you just don't have any more left. And that's why I think we kind of fall into that hangover phase. And so I think if there's anyone out there who may be listening today who feels like that happens to them, right? Like they can, quote, perform, right? If let's say you have a big event coming up, a work project, whatever the case may be, and you're performing, right? You're doing it. You're making sure it's perfect. You're the hostess with the mostest, so to speak. And then after that, you feel like you're crashing. And if this becomes somewhat predictable for you, then my advice is to build in recovery time. Make sure that, and if it's a big work project, it's obviously helpful if you have employers that are maybe more understanding.
Sure.
But build in some time off for recovery after. It doesn't necessarily have to be a full vacation or something, but give yourself that opportunity. Give that opportunity to rest and to try to jump into activities that are going to be boostful to you, and elevate those neurotransmitter levels, because that's really at the end of the day, that's the key. The key is making sure that you have the chemistry that you need to go on and fight.
I think a lot of that could be helped with just taking simple breaks as a task is completed. Don't sit there. If you have the ability to get up, walk away from the computer at work, whatever project you're working on at home, give yourself an opportunity to kind of refresh. Take a moment to stop thinking about it, stop worrying about it, stop dealing with it. Just kind of get up and take a break. You'll come back and you'll find you'll have a little bit more energy to re-engage with the task.
Yeah, perfect. I agree. I think that's the point. Be aware of some of the things that we may individually struggle with. Right? We all have some of it. Doesn't have to be ADHD. It could be anything, right? But we all have things that are going to be a little bit more of a drain to us. And so as long as we prepare for that, give yourself a break, right? Mm-hmm. I think that's vital in how we recover from those things. So, yeah, I couldn't agree more with you, Phil. One other thing too, though, that I thought was important with ADHD, or maybe interesting with ADHD, and something, again, that I see in my clinical practice, the diagnosis of ADHD, I think, has expanded significantly since the start of the COVID era, pandemic, people working from home. And I think part of that is probably somewhat obvious, and that is when you lose some of that structure, right? Yeah. That built-in structure, and now you put people into a different setting, one in which maybe is not built for productivity, or at least didn't need to be built for productivity. This is what I've seen. I've seen a lot of people coming into me as adults who never had a diagnosis of ADHD as a kid. Maybe it was never even mentioned or considered, and now we're really struggling with this. And so this is something that, if anybody out there potentially could be listening that sounds familiar, don't hesitate. Go to your doctor, talk to them about this. Say, hey, could I have this? And come up with some strategies to help.
Mm-hmm. And I think it's interesting that it wasn't something that was more commonly either recognized or even really looked at for adults until a little bit more recently.
Yeah.
I was diagnosed in the 80s with the ADHD, and as we mentioned earlier, it's not just a kid thing. Mm-hmm. I legitimately, as a child, I thought it was something that was, just part of my adolescence. I thought I would be growing out of it.
Sure.
And that's never the case. as I mentioned, it's something that you kind of learn how to adapt and deal with in a different way.
Yeah, absolutely.
And you develop your own strategies for
sure.
dealing with things through life. But it's interesting that it's not something that was recognized as much for adults until more recently.
Sure.
I wonder why that is.
Well, and I think most people agree that so that's sort of myth number 2, right? That you grow out of it as you get older, and I think that was a common misconception in the medical community, and perhaps it was in part because, like you mentioned, people do start to develop strategies, or at the end of the day as well, if somebody ends up, say, going into a profession or a career that maybe is better suited for their ADHD. Perhaps they've landed into that because of this, and so because, like we talked about, it's not necessarily that there's a complete lack or ability to focus, but certainly things that are not going to boost those norepinephrine dopamine levels are not going to be of interest, and so things that we tend to gravitate towards tend to be natural, we'll say, boosters, and that I think that brings up another interesting thing that we're starting to see. I do think part of the boom of ADHD symptoms in adults is partly due to the food we're eating. It's that hyper processed food. Those artificial sugars. There's lots and lots of data that links these to increased ADHD symptoms because they actually deplete norepinephrine levels, and so then what the question may be: how do we naturally boost norepinephrine levels? Well, there's a few things. Exercise, natural boost of norepinephrine. So carving out time in those busy schedules to exercise is key. Sleep, adequate sleep. Now, this can be a problem with ADHD. There tends to be a lot of, we'll say, comorbidities of sleep deprivation or sleep disorders with ADHD. But trying to prioritize sleep or focusing on strategies to help with your own sleep, that can boost norepinephrine levels. Actually, interestingly, cold immersion. So if you find yourself sort of, I kind of call it, we'll say, the ADHD spiral. Some folks, let's say they get into a little bit of a funk, if you will, with it, and they find that they're just kind of bouncing around a little bit. They can't
focus.
Right. They can't find that thing to really kind of settle in on. There's some evidence that taking a cold shower, or here here we are in the winter, or heading into the deep dark days of the winter, walk outside, perhaps, see if it works.
Maybe set up a tub outside and just do the polar plunge.
There you go. Be like athletes, right? Recovering from a game.
Exactly.
And apparently that does boost norepinephrine levels and can perhaps get somebody out of maybe one of those sort of vicious little cycles.
Interesting. Well, I do like the fact that we're talking about how to deal with it as an individual like myself that's a holder of the ADHD card. But what about for those that maybe they don't have it, but somebody in their life does?
Yeah. Well, and actually,
significant others, or
yeah, absolutely. This is actually an interesting thing too, because and I know you're maybe more referencing like advice for say those in a relationship with somebody who has ADHD and how we can maybe be a better partner for them. But actually,
maybe you don't have it, maybe your children does, or
sure,
maybe a friend, or like I said, even somebody that you work with.
Sure. Well, I think too, before maybe jumping right into that. This is another thing I've commonly seen in my practice, because like we've talked about, ADHD mostly being diagnosed in children, and even still today, it's actually mostly diagnosed in children. But there are maybe slightly different diagnostic tools for that. What's called the Vanderbilt assessment forms.
Mm-hmm.
These are those. They go to parents, they go to teachers, and if you've had, we'll say multiple issues across different domains. That can garner a diagnosis, and then of course those forms can be used to track progress. So if you started treatment, for example, you can see the response to treatment. But what I'm seeing now is folks coming in because their child was just diagnosed, and it was like staring into a mirror, right? Because they're seeing all of their own child experiences come to life in their own child, and because maybe hopefully there's been a little less stigma surrounding some of this as time's gone on. Because there was a time where, like you said earlier, it was just considered laziness.
Right.
And so now that we recognize, at least we're starting to recognize better that it is not. I won't say there still aren't old school thinkers that fall into this unfortunate thought. Right. But that's another way I'm actually diagnosing a lot of folks, is that they see it in their children. Their children have been diagnosed. Their children have responded wonderfully to treatments. And so then they're coming in and saying, hey,
it might be me too.
It's a chip off the old block.
Right.
And
Apple didn't fall too far from the tree. What's that old saying? Yeah.
Exactly. Well, exactly right. And then kind of maybe going into the crux of what you initially asked, I think providing that, sort of safe place for whether it's your child, whether it's your partner, whether it's a friend, trying not to be judgmental, recognizing that sometimes, say if it's an impulse, because I find impulse control issues are probably some of the more frustrating ones, right? Mm-hmm. We see those and it's like, come on, what are we doing? Especially if if your child has impulse control issues, and you want to, sometimes you want to squeeze them, right? But at the end of the day too, trying to just take that your own step back and recognize that, hey, this is a medical disorder, right? This is not someone who's just trying to misbehave.
Right.
And so I think understanding that doesn't mean it's going to be not frustrating at times.
Absolutely not.
But understanding that, I do think, will at least help you become a better advocate, a better partner, a better coworker. And so I think that would be really my advice: is take a step back, and then maybe take some of these tips and tricks that we talked about here today about, say, some of the lifestyle components. Here's some things we can do together to try to help reduce some of those symptoms.
This has all been fantastic. Like I said, I know there's just so many different avenues that we could take with this, and not even has a little play on ADHD itself. But there really is so many different things we could talk about, so many little subtopics from this. It is hard to really kind of get an all-encompassing in this. I like this topic, obviously. So I'm looking forward to hearing some feedback from our viewers to see what their thoughts were, personal experiences they may have had, and questions that they have that we can help with.
Yeah, absolutely. I think, similar to maybe some of our previous episodes, if you're tuning in again, we very much appreciate it. But trying to do kind of high-level overview, dip our feet in a little bit. Mm-hmm. Certainly happy to dive more into the science, too. For those who really are interested in things at the molecular level. If this is something that you would like to hear more, say, anecdotes about say, patient experiences, those are also things we're happy to jump into. Before I let you go today, Phil, off the beaten path a little bit, made my own ADHD moment here. So depending on when you're watching this or listening to this, we are in the midst of the holiday season. Haven't quite reached Christmas yet here. Big question for you, two-parter. One, what's your favorite Christmas movie?
Fantastic question. And I love the fact that we're taking this little rabbit trail. I'm having a great time with it. I'm going to be honest with you. Over the years, I've watched several different movies. I have several that we will watch routinely every single Christmas. I'm going to have to say, my favorite one we actually just watched last night. If you want to know, today is Saturday. Christmas Vacation.
The best.
It is. It really, truly is. And I love the fact that after having watched it for decades, my wife and I are sitting there watching, and we're still picking up little nuances, like a sign in the attic when Chevy Chase was up in the attic hiding the presents. There was some sign about the announcement of the son. Congratulations on the birth of your son.
Yeah.
And it's just great to see little details that we've never seen before, and just still enjoy the movie year after year.
I agree. Best Christmas movie, in my opinion, is National Lampoon. And I actually don't even think it's that close, personally. Second question, is Die Hard a Christmas movie?
I'm going to go ahead and say yes. And go ahead and fight me on this one. I dare you. First off, there's sleigh bells. Like right at the beginning when the title comes in, he's at the airport, sleigh bells right there. What kind of movie besides a Christmas movie has sleigh bells? All right, there's Christmas music, there's Christmas references. They're at a Christmas party. He uses Christmas wrapping duct tape to put the gun on his back. It's a Christmas movie.
So I'm going to have a confession here. I have never seen Die Hard. So we have to fix this.
Yes, we do.
And actually, if you guys are interested, we can watch it together maybe. It's funny because I know this is an age-old argument, is Die Hard a Christmas movie? So I'm aware of the argument, even though I've never actually seen the movie. So before I go and watch and make my judgment, I do want all of you out there, tell us, A, what is your favorite Christmas movie? And B, is Die Hard, in fact, a Christmas movie? I think that's all we got today, Phil.
I think we covered a great many things. I forgot what we were talking about earlier because we started talking about my favorite Christmas movie. And yeah, it's been a great episode.
Well, hey, I'm Dr. Todd.
I'm Phil.
This is On Call Medicine. Until next time, live well.
Live well.